Okay, we're continuing through my quote book. I just have, these quotes all over the place, man. I got the original old book, about 800 pages, but I got 5,000 pages of these quotes, and I haven't really organized them too much. So this is just going to be some medical quotes and jokes that I've accumulated. I got tons more, but this is just what I have sitting here. The patient trust in the doctor generates more of a placebo effect. I think that's true. I've seen these old doctors that really are good at talking to patients, and the patients like them, and that seems to help the patient get better outcomes. Francis Weld Peabody, he says, secret of care for the patient is caring for the patient. Okay, yeah, but he kind of means that in a superficial way. I think in a deep way, when you really care for the patient, you teach them nutrition. Okay, but even when you care and you teach them, you don't get paid for it, and the patients usually don't want to listen to it. Don't get me wrong. Sometimes they like hearing it, but they usually don't follow through. More and more scientists are realizing the futility of reductionism in science. Okay, what I'm quoting here is this guy, I think his name is B.M. Hedge. He's an Indian doctor who wrote a book like What You Don't Learn in Medical School, something like that. So here is this quote. Actually, let me just scroll up, make sure that's who I'm talking about here. Yeah, that's him, B.M. Hedge, What Doctors Don't Study in Medical School. So here's what he says. More and more scientists are realizing the futility of reductionism in science. Yeah, reductionism is most of the time a joke, but it's more than that. It's a lack of nutrition, epidemiology, and toxicology, please. Okay, he says, closed minds have no place in serious science. Yeah, you must obey the protocol or you're a jerk. And listen to what he says here. He says, a group of leading cancer surgeons have shown that surgery causes accelerated growth of metastasis. And it was Doctors Demicelli, Hrushki, and Retsky. I would say it depends. Depends on, the context of the surgery and how robust the patient is. If the patient is real debilitated, the surgery can kind of overwhelm their immune system, I think. And it's the immune system that keeps cancer under control. So that predisposes them to, a poor recovery. But it depends. That sometimes happens, sometimes doesn't. But it can sometimes happen. Okay, that's an interesting paper. Okay. Unnecessary screening generates more patients and more business. It is disease mongering. Yeah, I think screening is a big scam because what I've seen, I've been doing screening for over 30 years. You see tons of turtles and the patient gets worked up out the wazoo and sometimes overtreated. They get freaked out, stuck in follow-up routinely for 2 years, sometimes for 5 years. More than 90% of healthcare dollars go to keeping patients alive in ICUs during the last 10 days of their lives. There's a lot that goes into that. Based on my extensive knowledge of healthcare and medicine, I try to stay healthy as I can and avoid the healthcare system. Sometimes you need it. It's especially good for acute care stuff and sometimes for end stage stuff, to put you on dialysis, do an artificial knee if you absolutely need it. Drug companies have become a Frankenstein that is difficult to put back into the bottle. Physician specialization and reductionism have killed any real progress. Yeah, that's the other thing I want to tell you is there's always this, pretend nonsense. This is evidence-based medicine based on science, and we want clinical trials based on randomized control studies. Well, you can't do randomized control study. You can't randomize nutrition and diet, okay? It's a way to keep all that stuff out. And what I'm trying to say is, again, I've been a doctor, about 35 years, okay? And I can tell you, there's been almost zero progress in the treatment of patients, close to zero. I've seen a few things get better. Hepatitis C patients live longer. HIV patients live longer. Get a little bit of an improvement in liver cancer patients with chemo-embo. They're a little better at declotting dialysis grafts. All of that's nice, but these are what you would call micro improvements. The hepatitis is a macro improvement, but what I'm trying to say is the patients are dying of the same thing they were always dying of 35 years ago. Diabetes, hypertension, atherosclerosis, coronary artery disease, stroke, and cancer. And they're even worse nowadays because of nutrition. The food's getting worse with all the processed food. So it's really a joke. What's improved? The diagnostic technology has improved a lot. Like if I do a biopsy, I used to have to do core biopsies all the time. Now most of the time they can get the answer, which means an 18 gauge needle, a big specimen like an inchworm. Nowadays they can get the answer almost all the time with cytology, just micro fine needle aspirates with 25 gauge needles, okay? They've gotten a lot better. The CAT scan's a lot better than it used to be. The MRI's a lot better than it used to be. The ultrasound's a little bit better than it used to be. Ultrasound guided procedures are way better than they used to be over 30 years ago. So all of that is real progress, but still these are micro progressions compared to patients' overall longevity. Patients' longevities are decreasing. People are fatter, sicker, and stupider than they ever were before. The one thing is they don't smoke as much, so I get less COPDers, emphysema type patients. But medicine is not. I mean, I think the blockage of technology improvement has been a disgrace. Technology's improved a lot in computers. You know, there's artificial intelligence. Like I said, all those faster CAT scans and MRIs depend on computers. But in terms of like helping patients get better, I think medical progress is a disgrace. Okay, anyway, I think it's fake. Look, there's no improvement in cancer. Cancer patients are worse off. All those other patients are worse off than before. And like one of my friends said, you know, patients got better outcomes in the 1940s, 50s, and 60s with Dr. Kempner than they do now with all this high-tech BS. Okay, so let's see. What is next? He says, if I have a genuine interest in a patient's welfare, the patient will have faith in me. That matters a lot. Faith heals. Well, it doesn't heal if you don't know what you're doing, okay? If you're still prescribing a stupid drug that don't work, then you're going to, the patient's confidence might get you a little placebo effect, but it's not that great. Having practiced medicine for 4.5 decades, I have come to believe that reductionist science in medicine has come to naught. Yeah, it's kind of a big joke. The people who really know it. There's always going to be some smoke and mirrors and all the big money's behind reductionism. Reductionism means when you're looking at these fine points that really don't matter, just trying to imagine you can put everything into a drug. It's fantasy land because, hypertension. How are you going to put all that potassium, magnesium, fiber into a drug, okay? Eventually what heals the patient is the patient's own immune system. So more effort should be put into optimizing the immune function, which means low fat, low sodium diet, get your sleep, manage your stress, avoid caffeine. Deep down, the science of modern medicine is very shallow. That's the truth. That's a true statement. When you really start getting down to it seriously and go through all the papers and something, you're like, holy shit, this is bogus. Okay, he says, serious doctoring needs serious thinking and not a parrot repeating a book. Yeah, the books are a joke. That's why I've rewritten the textbooks, okay? Professor Firth. Man is born with only two instincts, self-preservation and procreation. There's some truth in that. Okay, most, if not all, treatments for chronic disease this is a guy named David Eddy. He was a former cardiovascular surgeon who became a researcher, and he started looking at the treatments. And most treatments for chronic disease, like diabetes and high blood pressure, do more harm than good. The problem is that we don't know what we're doing. That's because you don't, pal. But if you knew nutrition, epidemiology, toxicology, and dental, and all this other stuff, you would know. But you don't know, so you don't know. Okay, anonymous. Why do old men make the best gynecologists? Because their hands shake. Okay, one doc would say after conference, I've given you enough pearls to make a necklace. Another, the old saying, Emile Coué, his mantra for the patients in France. Every day in every way, I'm getting better and better. That'll give you a positive mental attitude. Why do they put nails on coffins? To keep the doctors away. Looking for a tumor on a mammogram and a dense breast of a young woman is like looking for a polar bear in a snowstorm. Yeah, I used to hate mammography in the premenopausal women because, it's like their whole breast is glandular tissue. What are you going to see? And then they all think they got cancer. They're all crying, and almost all of them have nothing. Anonymous. Lots of stents in the arteries is a heavy metal approach. Oculostenosis stent reflex. We tease cardiologists about that. This is the Achilles heel of this procedure. Those are just some good lines that I heard different lecturers say over the years. The reason the grass is always greener on the other side is because there's more SHIT on the other side. One case, when I was at Harvard doing a fellowship in vascular interventional with an emphasis on vascular disease, I like doing a catheter in the common femoral artery. You go around the common iliacs to the other side, contralateral side, catheters down by the level of the knee and the popliteal artery. And there's this, cute little nurse would walk around, and whenever we have a catheter position and we're infusing thrombolysis to dissolve a clot in the guy's arterial system, in order for billing purposes, we have to describe the catheter position when the thrombolytic medicine, the clot dissolving medicine, was infused. Okay, so the nurse would go, "What artery?" And I would say, "Baloney pop." And she goes, "Excuse me?" And I said, "Baloney popliteal artery." I said to myself, "What are you thinking?" Okay. Another name for primary care is primitive care. And then now we got a couple quotes by Sir William Osler, sort of the great internal medicine doctor of around, early 1900s. He said, it's more important to know what kind of patient has the disease than what kind of disease the patient has. Yeah, if the person's intelligent, you can teach them about nutrition. You try with everybody, but most people can't handle it. The greater the ignorance, the greater the dogmatism. Yeah, the more bogus their treatment, the more they lock their heels in some field that they don't want to change it. It's because they're making money off it. Osler, a good physician treats the disease. A great physician treats the patient. One of the first duties of the physician is to educate the masses not to take medicine. Patient doing well, don't interfere. Yeah, people who are getting better tend to keep getting better. People who are getting worse might keep getting worse. So then you are more inclined to intervene. Lewis Thomas, he wrote a couple books. He's like a scientist guy. The highest technology in medicine is complete understanding of a disease so that one can eradicate it. Yeah, you want to know what causes it, because most of the time removing the cause gets you a cure, at least gets you an improvement, at least gets you stabilization of the disease. Montaigne, I would prefer to trust a physician who has himself suffered from a malady he would treat. Yeah, it's a little bit like Carl Jung, only the wounded physician heals. Yeah, when you've had a problem, like I was fat, so I know a lot about becoming unfat. I've had a couple injuries. I learned just to avoid those things. I've seen my parents go through a lot of things with cancer, coronary disease, so I learned a lot about that, plus I had a lot of clinical experience with that. Anyways, I think that's all I got for medical quotes and jokes for today. I hope you found that interesting.